I'd like to mention the last example, which was probably the extreme situation that I've ever experienced in my therapeutic work. Again, when a major resolution of a number of problems happened within the context of a very unusual transpersonal experience. I was working in the Maryland Psychiatric Research Center, and this research center was built on the premises of Spring Grove State Hospital. And we were working with patients from the hospital. We were doing psychedelic research. And to our surprise, one day, Dr. Savage, who was the clinical director, and myself got an invitation to participate in the staff meeting, which had never happened before. And then when we came, we understood why. And they were basically demonstrating a patient who had been there for 11 months, and this was a clinical session that was supposed to decide whether she would be referred to a chronic ward. And they wanted to know if there was anything to do. And so they reviewed all the things that they have done with her, and nothing helped. She was a very complicated patient, and, with a very sweet voice. The director of the Spring Grove Hospital said, would you consider taking this patient into your program and I give her LSD therapy? This was the time, the late 60s, where LSD was making headlines, and there were all these horror stories that were being publicized. This was a patient who had a criminal record, who was suicidal. There were sort of already guns involved and so on. It was very clear that if something would happen after her session, that it all would be blamed on the psychedelic session rather than on her history. So we had long discussions about it, but finally we decided there was nothing to lose, because otherwise she would end up in the chronic ward, and this was basically like sentence for life. So we accepted her, and I became her guide. We could give 3 psychedelic sessions, 3 LSD sessions. This was our protocol. I ran 2 sessions with her, which were very dramatic. There was a lot of violence and sort of sexual abuse in the family. So she was reliving a lot of these scenes, and then the process took her to a difficult birth. She linked a lot of the aggressive and the self-destructive impulses to the birth process. But she didn't make any major breakthroughs. And then in the 3rd session, she had just maybe 20 minutes of the kinds of experiences that she had before, and suddenly in front of me, she kind of turned into this mask of evil where her whole face was kind of constricted, and suddenly there was a very evil expression in her eyes, and a deep male voice came through her and introduced himself as the devil, and basically started sort of blackmailing and threatening me, telling me that she was sort of his, and then was telling me all the things that could happen to me and to the program if I don't move away. But as part of the blackmail, there were things that this entity was referring to which the patient couldn't have known. It was a very charged situation for me. I've never seen anything this extreme, this kind of evil, tangible presence. So I was at the time holding her hand, and the hand was kind of spastic, was more like a claw. I was getting this outpouring of these obscenities and these invectives and threats and so on. And I had a really profound experience of fear, like sort of metaphysical fear. I've always read about these entities, about evil, and suddenly I just, and here it is, so it's really true. What I finally saw when I was responding to it emotionally, whether it was by anxiety or by trying to fight it in some sense mentally, it was kind of making the whole situation more real for me. So I finally decided to quiet my mind and to go into like a state of meditation and meditate on light. I remember that these things don't like light. And this went on for 2 hours, a very long 2 hours. And then suddenly the face started relaxing and the hand relaxed. And then she kind of shook, and her regular voice came through, and she basically connected to the part of the session before this happened. She was in a wonderful shape. We had a great discussion, and I spent a lot of time thinking about whether I should tell her what happened or not, and then I decided against it. And she went back to the ward, and then came next morning for the post-session interview. Was absolutely radiant. There was no sign of depression anymore. She felt clear. And then within about 2 weeks, she was released from the hospital. And again, there was a lasting, major improvement. So again, one of the, if not the most dramatic transformation I've ever seen in my life, and happening through a mechanism that I don't understand to this day. So we see very frequently in this work that things that get resolved in a way that we don't rationally understand, which is an interesting contrast to what I was used to when I was doing verbal psychoanalysis, where you frequently feel that you get a lot of understanding and things don't change very much. If I have the choice between results without understanding or understanding without results, I certainly opt for results that I can't understand very well. After this general discussion about introducing the transpersonal principles into therapy and the new insights concerning philosophy and strategy of treatment, I'd like to talk a little about a therapeutic technique that I've developed together with my wife Christina, a technique that we call holotropic breathwork. Basically, it's something that we developed at the time when we were both in the SLN Institute and where we couldn't continue the psychedelic work and we were looking for some kind of alternative. This is a non-drug technique that actually uses extremely simple means, accelerated breathing, evocative music, certain kind of body work, and then mandala drawing, and then group sharing, talking about the experience. So it can't get much simpler than that. Yet it's a very powerful technique which induces a non-ordinary state, and people would have a whole spectrum of experiences that we used to see in psychedelic sessions. The difference is that they are much more controllable. People actually have to work for getting further, whereas with psychedelics it's possible to take a big dose and feel absolutely overwhelmed by the experience. Here the person can renegotiate. If they don't like where it's going, they can kind of pull back. They can decide not to continue, which is not recommended. The idea is to go through whatever comes up, but the person has essentially the choice how far, how deep they want to go. Now, I would like to say something about the elements of the holotropic breathwork, beginning with breathing. Breathing is something that throughout centuries has been used in many different contexts in ritual and spiritual life to induce powerful, non-ordinary states of consciousness with kind of a spiritual content. There are many different things that we can do with breath to change consciousness. For example, some of the Aboriginal techniques are extremely drastic. Also, some of those that were used in some of the early religions. There are cultures that would use smoke to half choke the initiates. Very few people know that the original baptism was a situation where 4 or 5 people would take the initiate to the river and then hold the head underwater until the person came close to drowning and then would surface them.